We didn't do mass testing until now, you know. We
Mhm.
started late. We became complacent that there was no community transmission. I think at the start, when we only had 3 cases, we felt that it was important. And even the president was saying, you know, we can do domestic tourism. We
Mm.
started late, January, February. We started the quarantine March 16. And
Mm.
even during the quarantine, so far we have been 3 months of lockdown. I have barely gone out of this house, you know,
Mhm.
because I'm 70 years old. Stay home has been the call. But
Mhm.
even then, during the lockdown, mass testing was not really implemented. Until
Mhm.
now, the average test we have done so far is 14,000 per day. When the
Yeah.
government said by the end of May, we should be able to do 30,000 testing. So that's a major health shortcoming.
Yeah.
The social
Social
amelioration program
amelioration.
also started late. The initial guidelines came out April 6 or almost a month. Yeah, that's up. And then the guidelines were changed because these guidelines were not rooted on consultations with local government units. So many steps taken were actually control rather than information dissemination. You know, so the
Mm.
lockdown, the shutting down of a major, I'm sorry, station, which could have been the source of information, contributed to that. People,
Mhm.
I believe that people would follow if they understand fully what it mean, what it means to be to stay at home if they're provided with enough provision. So
Mhm.
instead of doing that, we always call on pasaway, pasaway, pasaway. So the steps have been suppression rather than information dissemination and people's participation. This is a community transmission. The community has to be involved. If you don't involve the local government officials who are elected, how else can you involve the non-government organizations who are more than willing to help in mitigating the pandemic? First, come out with a report of the breakdown of the COVID-19 response. Where did all the money go? The report has been so much money, you know, from the DBM. We haven't seen the breakdown. How much did actually go to the health aspect, you know, hiring of new doctors, setting up of new quarantine areas, mass testing, etc.
Mhm.
Two would be assessing why lockdowns have been very militaristic. Why have we not been able to combine the initial community quarantine with the health requirements of testing, treatment, isolation treatment, and contact tracing? We haven't done that extensively so far.